I have always been doing treatments on my own body first, and then telling the patients and the public society. And here the setup is happening. This is the peristaltic pump which you're seeing here, where the blood which is going to be taken out from my body is going to get pumped in, and the lock is applied in the peristaltic pump, and the setup is being happening. The machine is being set up. So for y'all to know, because Eboo therapy in India is quite new. It has been practiced all over the world for a long time. We have set the machine at 100 RPM, revolutions per minute, and we use the Nextworth machine, and that's how we set it up. We can increase and decrease the speed. This should be one of the rarest videos. That's the oxygen cylinder, and it's set up at 1.5. That's the oxygen coming in, and this is the ozone going out the tube, for you to know the connections. This ozone gets connected to the filter on top over there. That's the donor or receiving end. That's the three-way knob. The blood is already being drawn out. The peristaltic pump will start pulling the blood from the body. That's why the peristaltic pump is being used, and that's heparinized saline, normal saline with heparin. We've taken about 3,000 international units heparin, and that constantly needs to be pushed in so that the blood doesn't get clotted. The pulse oximeter is there to ensure that the oxygen saturation level is good. We ensure things are all going fine, and on the receiving end, the blood is to ensure that the blood doesn't get clotted. We push in some amount of heparin fluid as well. This is the amount of all the heavy toxins, metals which are collected, the microplastics in the saline which come out in the plasma. This is an edited version, so because the entire thing will be boring for you. So after the procedure is over, this is all the cholesterol, LDL, triglycerides which are there, the heavy metals, microplastics in the blood from the filter which has come out. So this is the level of toxins which are there in the body. For you to know, I am a non-alcoholic and a non-smoker as well, but considering the amount of toxins we take in from the vegetables, fruits, from the air, water, and we need to cleanse our blood, the system regularly, even if we don't have a clinical problem. So even normal people can take it. Then you can imagine people with problems like inflammation, infections of any kind can take it. People who should not be taking it, or with caution to be taken, are G6PD deficiency people, anemia and blood dyscrasias patients should avoid. This is the filter which we are showing. This is the amount of toxins which are collected. That's the toxins which are collected at the bottom as well. So it's a considerably significant amount. Why I did it on myself is just as an anti-aging thing. And to tell you, I had a lot of pain in my right second molar tooth area because there was a fracture in the tooth, and that inflammation completely subsided. And this is the entire thing which I'm showing you. It's relatively simple to start doing, and it's a good thing to learn. If it'll be very useful for people who have knee pain of any sorts, for degenerative conditions, eye conditions. I am using for my patients who have retinitis pigmentosa, macular degeneration, dystrophies, diabetic retinopathy, uveitic conditions I am using regularly. Otherwise, obese individuals, diabetic people, hypertensive people, it is very, very useful. So you should consider this on yourself, who is watching, and doctors, please start learning it and doing it on your patients as well. If you have any doubts, please reach out to us at the number given below, or come over to Dr. Sasi Eye Care at Salem and to know more details. Thank you, Dr. Sasi.